fourth webinar on complexity theory for better public services, hosted by the UNESCO Child and Family Research Centre at the School of Political Science and Sociology at the University of Galway. My name is Aisling Gillen. I'm a visiting research fellow with the University of Galway at the UNESCO Child and Family Research Centre. I'm joined by my colleague, Professor John Canavan, who is Director of the UNESCO Child and Family Research Centre and who will act as moderator for today. Just a big thank you to Gillian Brown from UNESCO Child and Family Research Centre, who's responsible for all the logistics for the setup of the webinar today. Thanks, Gillian. The theme of today's webinar is complexity and leadership. We are joined today by Professor Mary Ulbian, who is BSNF Endowed Professor of Leadership at the TCU Neely School of Business in Texas, and Mr. Tony Canavan, Regional Executive Officer West and Northwest with the Health Service Executive Ireland and former CEO of the Ceuta Hospital Healthcare Group. The format today is that Professor Mary Ulbian is going to present on complexity and leadership and is going to engage in questions and conversations with Mr. Tony Canavan, who is the respondent today. And there will be time for questions at the end. Professor Mary Ulbian, you're very welcome, Mary, is a renowned and lauded expert and educator internationally on complexity leadership, relational leadership, and followership theory, and has published widely and successfully in the world's top management and leadership journals. She has been a visiting scholar in many countries, a founder of the Network of Leadership Scholars in the Academy of Management, a recipient of the Eminent Leadership Scholar Award from NLS, ranked 6th in the world in terms of most influential scholar, and is a regular contributor to and commentator on CNB Squawk Box US. And these are a small sample of her accomplishments. One of Mary's big interests, which is mirrored in the UNESCO Child and Family Research Centre, is the whole area of translation of theory into practice. And that is really important. Mr. Tony Canavan, and you're very welcome, Tony, has recently taken up role as Regional Executive Officer West Northwest. This is a significant leadership role in the health services in Ireland, with the establishment of 6 health regions on the 1st of March 2024. Tony has a wealth of leadership experience across primary care, public health, acute hospital services, mental health services, and since April 2021 has held the position as President of the Health Management Institute of Ireland. So Mary and Tony, we're very grateful to you for your time and expertise that you're giving us here today. Hugely grateful to you. And Mary, we're just very conscious that you have had a very early start coming from Texas this morning. So we appreciate the early start. Thank you very much. So I'm now going to pass you over to Professor John Canavan, Director of the UNESCO Child and Family Research Centre. So over to you, John.
Thanks very much, Aisling, and welcome to all our attendees. Just on my own behalf to say thanks to Tony and Mary for their contribution today, to Aisling and to Gillian Brown for their work in running this webinar. Aisling this is our 4th webinar, and Aisling is the curator and a steady pair of hands. You couldn't find a better person to deliver this work. My job today is very simple. I have to look after the Q&A. So if you do have comments or thoughts or questions, please use the Q&A function on the Zoom at the bottom of your screen. So that's the plan. We will be listening to Mary and Tony for the next period of time. And then at the end, we will have time for the Q&A, and I'll be summarising and maybe bringing some questions to Mary and Tony from there. So that's it. I think, Aisling, we just hand over to Mary and ask her to upload her slides and take it from there.
I'm happy to do that. So let me share my screen. Good morning, everyone. Good afternoon to all of you in Ireland. It's wonderful to be here. I love the way technology works these days, and we can all be together in this way. I think save carbon for the planet as well, which is kind of nice. The biggest challenge I have at this time of the day is to keep the dog quiet. So my husband is shepherding the dog in the other part of the house. She's a very noisy dog. So if you happen to hear some barking joining in, it's because she just likes to talk with me. So it's wonderful to be here. Tony, I'm very excited to be doing this with you today. Aisling and Tony and I had a practice round. We talked about the fact that we should have recorded it. It was such a great conversation. I think that could have been the webinar in and of itself. So we're going to try to repeat that here today. I feel very fortunate because normally I just talk through this for 50 minutes on my own. And because we had such a great conversation, we've decided to change up the format that I normally do. And I'm going to invite Tony in. So we are going to have a conversation. So with that, let's go ahead and get started. Tony, good morning, good afternoon to you. I was going to say good morning. Good afternoon to you, Tony.
Hi, Mary. Hi, everybody.
Yes. All right. So what we're going to do is start talking about complexity. I'm going to give a very, very quick background into how I got into this work. I started my research when I came out of grad school, focusing on relationships. So I focused on relationships between the manager and the subordinate, and that was called leader-member exchange theory. We grew that into a predominant theory, and it became pretty much one of the main theories that's being studied even today. But at the time when I was doing it, I started doing some work for organizations, and I was brought on by State Farm Insurance to be the consultant. And when I came on, I went to Jim Smith, so he would be the parallel to Tony here. And we had a conversation, and I said, well, what you need to do in leadership is you need to build relationships with your employees, with your subordinates. He's like, okay. So he went out and did that. He was very proud of himself. At the end of the day, he reported back to me on all the people he had talked to in the office that afternoon. So I went back a month later, and we sat down for lunch, and I said, how's it going with all of that? And he said, well, I have a confession to make. I'm not doing that anymore. And I said, oh my gosh, why? He said, because that's not my job. He was an executive, and he didn't have time to go out and just walk the halls all day long and talk with people about babies and birthdays and football. At the time, it was Super Bowl. So that set me off on a journey. I was a young professor, a young scholar, and I wanted to do something that had real significance. And I think that Jim probably taught me much more than I taught him at that stage. So I was looking for something that would help us to understand what leaders actually do, how they actually work. A lot of our leadership theory comes from psychology. So it's very much focused on the individual and what's in our head and on relationships and the kinds of things that I was studying. But it didn't take into consideration the context. And that's really what Jim taught me, was that there's so much more happening for a leader. And in particular, in his role, a lot of the strategic issues that he had to address. So I was fortunate in 2001 when the editor of Leadership Quarterly introduced me to Russ Marion, who was doing work on complexity. And Russ had written a book, and it was called The Edge of Organization. It was taking complexity from the physical and biological sciences and applying it to leadership. So Russ and I started working together. I read his book, and my head just exploded. I just went crazy. I remember I was reading it on my pool that summer. I was living in Florida, so everybody has a backyard pool. And I was floating on the pool reading this book. And my head was just, I'm looking out at the world and at nature and thinking about all of these things that happen, the natural forces and dynamics that happen in the world. And I thought, this is it. This is what I've been looking for. So at that point, we started using complexity. And I would say I would put on my complexity hat. What would complexity tell me about what's happening in this situation? And so for the first decade or so, we were really exploring how to work this. And we were talking before in the pre-call about how often research and theory doesn't really apply to practice. And so at the early stages of this work, we would talk and no one knew what we were talking about. So we've been working it, and I really started partnering with practitioners to figure out, how does this work in your world? And we had great people on our team. So what I want to share with you is that work, and share with you complexity. And when we got to 2020, people knew. Prior to 2020, people would say, what is she talking about? Or if people would say, I don't like this. I don't like the way that the implications of this and what it means for what I need to do. And then 2020 happened. We went to COVID, and everybody understood we are in a very different world. We're in a complex world. And in that world, we need to understand what it means to be a leader and how we go about doing things in a different way from perhaps the way we've learned to do this. So I'm trying to hide my meeting control so I can see my screen. All right. So what is complexity? Complexity is about rich interconnectivity. It's about the way that things work in the world. And in complexity, I work with healthcare a lot. There's so many things happening in the macro context that are affecting us. So in healthcare, I talk about this in terms of the violence in American hospitals. I hear that when I'm out speaking with people who are actually with patients. The burnout issues that people are dealing with, really major issues around exhaustion, burnout, et cetera, when people are trying to do their jobs in healthcare. And I'm going to ask Tony in just a minute to talk about a slide that he put in and ask him to comment on complexity. But let me describe it in the simplest terms. Complexity is about rich interconnectivity. So in that rich interconnectivity, when things come together in interconnected systems and they bump up against each other, they can create what's called a phase transition to a different state. So in that phase transition, what happens is unpredictable events emerge. We don't know that they're going to happen, but once they happen, we're in them and we cannot go back. So there's no going back to the previous state. We have to be able to engage in the emergence generated by complexity. So Tony, I want to ask you, in your situation, what kind of complexity are you seeing and experiencing, and how is it changing the way that you need to think about the work that you do?
Yes, thanks, Mary. Yeah, the headlines you've shared, I think, are the ones that lots of people in Ireland would be familiar with in terms of their experience or understanding of their public health services. So like lots of countries, our health system, our service, really struggles a lot with access issues, and we see that in the most basic way in our emergency departments, with patients lying on trolleys awaiting long periods of time in order to be admitted to hospitals. So that's one of the big access issues that we struggle with. But the other one, of course, is around access for elective care. Patients again waiting on waiting lists for again very long periods of time in order to just access care that they need in some sort of a timely way. To describe our healthcare setup or our healthcare system as being hugely complex is it's really understating it. If you think of the thousands of people working across multiple different disciplines, even in our geography, if I was to drive, within the speed limit from one end from north to the south, it would take, in excess of 4.5 hours. And the population is widely dispersed, and it requires all of the people that are working within the service kind of working together, and a lot of things happening at the right time in the right way in order to get good outcomes for our patients. So it is hugely complex, and I think part of that complexity is contributing to these access issues that are headlined on the slides just there. But that's healthcare. I mean, if you think about health, then as a component of that, a person's health, of course, is hugely complex as well. And it's, of course, our healthcare services contribute to that, and hopefully help to improve the person's health. But there are lots and lots of other factors as well that are at play there that do impact on the health of the individual, including the actions of the individual themselves. So it's a very, very complex setup overall.
So as we think about that complexity, then what we need to do is shift our thinking about what leadership is. And most of us are trained in the hierarchical model of leadership. So we're trained in the idea that leadership is management. We manage systems, we plan, we organize, we control. And that's not what can happen in today's world. So Tony, how do you have to lead differently when you're in complexity?
So it's, I suppose there's, really, I think what you need to be, what we try to do is be very clear about what it is that we're trying to achieve overall. So that may sound very basic, but actually, in the region that I'm now running, we've got 26,000 people. So to have all of those people pointed in the right direction, doing the right thing most of the time, maybe not all the time, that's being very clear about what it is that we're trying to achieve amongst the huge population that's working in our service, and then across a huge geography. That's the first piece, I think, the first leadership challenge. And then I suppose engaging with them on that, on how we're all going to get there. That's the second big challenge, I think, for sure.
Exactly. And so you can't manage and control people in the way that we have historically been taught. So what you need to do is what we call enabling leadership. So what I want to do is set that up and show what enabling leadership looks like and have some more conversation around that. So if we think about complexity and what Tony's describing and the fact that there's so much complexity happening, I like to talk about complexity as dots. My thinking around this is dots and lines. And the reason is because complexity is a network theory. It's based on network interactions, and it's based on the idea of agents in a system that interact. So we have lots of agents. We have people, we have technology, we have resources, we have information that are all interacting together in the environment that we're working in as leaders. So if we use the example of COVID to describe what happens in complexity, I told you that complexity is about rich interconnectivity. It happens in interconnected systems. The reason that we're having so much more complexity today is because our world is more interconnected than it ever has been. That then creates the potential for more of those interactions, those phase transitions that I talked about, to happen. And when those happen, then we find ourselves in emergence, in phase transition, in complexity events. I love this picture from the New York Times that described COVID, because it really is a visual of the way that my brain thinks about this. If you go to the original article, you'll find that that's an animation. So this whole thing is live, and it shows you that it started with a basic interaction. So if we go with the story, I don't know the reality of what happened, but let's go with the story of what happened. There was a bat that was infected with some kind of a virus that bit a pangolin, which is an animal that was in a market that a human bought, and that human ate the animal. And when the human ate the animal, something novel emerged. That was the initial phase transition that caused COVID and the initial complexity event. It's called a novel coronavirus. So in complexity, we're always dealing with novelty. Now, in an interconnected system, the reason this virus got so bad is because we also have emergence events that we need to think about as leaders. So in the market, once the human ate it, this was a highly contagious virus. It started to spread. It spread locally. But because China is now so interconnected with the world, this thing spread more. And as it spread more, it continued to morph and change. So I don't even know what variant of COVID we're in right now. But that is the basic idea of emergence. And so as a leader, when we think about engaging with the world around us, we're often dealing with emergence. And the events that you're dealing with, Tony, you can't control them. You can't plan them. You can't direct them. What you have to do is engage with them. And the examples you gave showed how big the ecosystem is, how interconnected it is, how much you're dealing with the change happening around you, and you're trying to figure out what to do with it. So when we talk about complexity, then we often struggle with it. And the reason that we struggle with it is because our organizational systems, our management and leadership theories were not set up for it. They were set up for factories, for factory and factory production. They came out of the industrial age. And in those factories, what we were focusing on was efficiency. We were trying to control efficiency. How do we take humans? How do we take their brains out of it, remove all intelligence, and basically make them machines? And so our organizational systems ended up looking like bureaucracies. Most business organizations today, and I'm a business school professor, most of them don't have bureaucracy in the way that they did in the past. Bureaucracy has been wiped out. And that has happened because they can't survive in a complex world with this structure that we see right here of silos and people not being able to connect across the system. That doesn't happen as much in the same way in business organizations. In government, though, quite often, it still does look like this. So one of the things that we deal with quite often is this issue of bureaucracy and the issues of silos. Then if we look at the individual level, people also individually are resistant to change. I don't necessarily like that term, resistance to change. I pulled this off because this is the traditional term, but they struggle with it. They can struggle with adaptation. They can struggle with things that are new. And there are different reasons. So I just pulled this chart because I think this is pretty common in terms of how we think about it. We don't like complexity because we don't get it. We don't understand it. We don't like it because we have an emotional reaction. It makes us feel bad. We don't like the stress of things being unpredictable around us. Or it could be that there's interpersonal conflict and we have that kind of level happening too. And we have individual challenges as we work through this. So we have organizational and individual level challenges that we're facing as we deal with complexity. We have to recognize that and think about, again, how do we do this differently then? If we know that people don't necessarily like it, if we know that there are challenges to us and we have managerial systems that are too bureaucratic and too focused on top down, the biggest difference is that we need to think about leadership no longer as an individual or as just me motivating you, Tony. Instead, we have to think of it as a collaborative process. So one of the biggest changes we're seeing in leaders, and they're doing this already, they don't know they're doing it, they don't have a name for it, but they're engaging much more collaboratively. The work that we do as leaders is in a collaborative process. And the focus of that process in many cases is on enabling adaptability. When complexity events happen, we have no choice. We have to address them. That's the purest definition of complexity. In COVID, people tried to do what they did in the past and they couldn't. They had no choice. They had to change. In that change, we often talk about this as innovation, and many people get bogged down in innovation because they don't think they can be innovative. And I hear that. I understand that. I see calls in organizations all the time for innovation. I tend not to use the term innovation. I use the term adaptability because that's the core to what complex adaptive systems are. Complex adaptive systems, which come from science, are able to adapt in the face of changes that are happening around them. So our real focus as leaders is on enabling adaptability. And it looks like this when we talk about a real picture. So the one side of this is the siloed structure, the hierarchy. That's kind of the old way. And the new way is more this network dynamic. This idea that people have to collaborate together and engage together. And it looks like this. Now, I want to say when we started our work, we were telling people, go to the network picture. And I'll never forget the bankers we were presenting to. They were looking at us like, you people are nuts. You're talking about ants and bee colonies with no centralized control. That doesn't resonate with us at all. We have these control systems. So Bill McKelvey helped us in 2007 to understand that complexity has both of these. You can still have the hierarchical structure. You must have it. That's the way that we organize our formal organizational systems. But a lot of the leadership and the way the work gets done is more of this network structure. So Tony, I want to ask you again, does any of this resonate with you? Do you want to make some comments on this?
Oh, well, for sure it does. Yeah. I mean, your comment about I mean, your lead in relation to COVID, for sure, it reminds me of our own experience through COVID. And again, you know, we had to just change our leadership approach entirely during that period because we had no choice. But it also reminds me of a much more everyday kind of a problem that we struggle with, which is around the trolleys that I mentioned earlier on, you know, and how we've over the years have tried to manage those in different ways and, you know, with different levels of effectiveness and I suppose what we come to learn from that as well. Certainly, you know, I'm just thinking about the winter just gone by. December, January, we call winter on the hospital side, and it tends to be a time when there are more patients attending hospitals, and therefore more patients awaiting admission on trolleys, and it becomes a real problem. And I know that our approach this year was very much along. It looked very much like the diagram on the left-hand side. You know, this kind of command control, kind of centralized decision making. Instructions issued from Dublin and then followed throughout the country, and therefore we solved the problem. But of course we didn't. Now, interestingly, we did make some improvements. There were probably temporary improvements, but they were valuable to the patients that benefited from them on those days, for sure. But we certainly this winter we reverted to an old way, kind of real command control directive kind of way of trying to manage this problem, which actually, you know, in order for us to move a single patient off a trolley and get them into a bed to receive the care that they need, it requires, you know, the input of so many different people in different ways at the right time, and people working within the hospital and people working outside of the hospital, the patient themselves, their family, all of that. And delivering on that problem or managing that one issue is a very complex, it's a really complex scenario for us that doesn't lend itself to a kind of how would you call it, command control type structure like what's depicted on the left there.
Exactly. So I love that example because we do tend to revert, and you've set up beautifully where I'm going with this. We tend to revert to that old structure, that old process when we're in these systems. I do want to say, I mean, that structure is great for efficiency. So if we're able to get efficiency and control, we want to use it. When we're in complexity, though, if we rely only on that, we're not going to resolve the issue. So I would say in the immediate short term, if you're in chaos and you need to bring it down to order, that's probably okay to do some of that, but you can't stop there. To really be able to address the problem, you need to be able to use this other picture, which is the collaborative process, the network map, to address it. And frankly, I think the way that you would do that is you would do it in the time when you're not in the crisis. So then you can look at it and you can say, okay, we know that that happened. We know it's likely going to happen again. So what can we do differently to try to work together and change this so that we don't replicate the problems? All right, so what we talk about here is the difference between the adaptive response and the order response. And Tony, when you say that you went back to that old way, the system is still in the old order. So it's going to happen again in the same way. In COVID, you said you didn't have a choice. You could not do things in the old way. You had to enable an adaptive response in the system. So that's what we call the adaptive response. And the big question is, how do we do that? How do we actually get to adaptability? We know how to do the order, but how do we get to adaptability? The problem of the order response is that it focuses on stability and old order, and it pulls us back to equilibrium. So it doesn't change us. It doesn't change the things that are happening around us. And in that case, if you're doing it in extreme complexity, it can lead to stagnation, which can lead to death. If you don't change, you die. It's that simple. It's that scary. That's what was different about COVID. COVID was a literal complexity event where literally you could die. It was an extreme event. In most cases that we experience in organizations and in our work life, death is not what's going to happen to us. But I commented earlier that business organizations have more adaptability now than they did in the past. And the reason is this right here. Business organizations can die if they don't manage themselves efficiently to keep themselves alive. They die. They die all the time. Business organizations are dying right at this moment all around the world. So I think the challenge becomes in a system that you're operating in, like a government-related system or a big bureaucratic system, where death isn't really the issue, the organizational death, the system death. How do we keep ourselves adaptive? How do we actually make ourselves break out of the order response and get to the adaptability? So I'm going to share this and we can have a conversation about it. But in complexity, the law of requisite variety in Ross Ashby's work way back in the decades ago, he talked about it takes variety to beat variety. And my complexity colleagues took that and called it the law of requisite complexity. It takes complexity to beat complexity. So what we have to do is we have to think about the situation that we're in. And Tony, you described it when you were dealing with the trolleys in winter. What people do is they experience that as chaos. And so they have the chaos and you drive it down to order. So you went to the order response that you know how to do. But if you stay in that order response, you're not going to fix it. You need to actually be in complexity. So what the slides I'm going to show next do is they help you understand, what does that mean? How do we actually take it out of the order response and do a complexity adaptive response? So I'm going to run through this, Tony, and then I want you to think about it and think about whether you have some examples of this. Okay. I will tell you that originally we would have told people be in complexity, just go straight to complexity. After COVID, I learned very clearly that people do experience it as chaos. If people are in chaos, and a system is in chaos, you can't function. So it's okay to take it down to order. Just don't stay there. So an adaptive response looks like this. It's the network picture that I showed you before of the interconnectivity. You need to have a collaborative process. You need to bring people together and you need to put them in what we call adaptive space. and have them engage together in trying to understand what is the problem and what is the challenge we're facing? How can we address that complexity challenge? You cannot stay just in the governance systems, in the committee, in the task forces, the old school task forces. This is what we try to do at universities. That's not the way this gets done. And it's highly dynamic. So it's not even like you have one group. You have a space where people are coming in and out. It's a network dynamic that's happening. Okay, this is the picture that I was showing you about what people do. They'll drive it down to order. They go up into this, they naturally go into the adaptive response, if you'll believe it. This is it is what people do. They run around, they talk to each other, they start engaging and ideating. And so that really does address the issue. But then once they start to go back up, they can get into chaos again. So as people are doing that, they can get overwhelmed. And then they're like, oh my gosh, we have too much information. We can't think through what we should do. And at that point, it's important for the leader to put them back in order, help their brains, then catch their brains again and take a breather and then go back into the adaptive space. So this is the basic idea of what's happening. All right, we call this now the adaptive process. We learned that what happens in complexity in the adaptive process is that people first experience pressures. So a pressure will happen. People know that complexity is happening and they need to change. The number one challenge here is trying to figure out, what is the challenge? How do we word this? How do we explain what we're in? How do we make sense of what we have to do differently? So there's a complexity challenge, and in that challenge, we start ideating. But there's a push for stability as well. So once you start that process and you start ideating, this is really the innovation piece over here. You get this counter force that pushes for stability, and these two things go into tension. So some people are saying the world is different. We have this problem. We've got to do things differently, and they might phrase it up in different ways. So one of the systems that I'm working with, they have a challenge with their structure. And they started to understand that because of consolidation in healthcare, they've brought all these doctors into the system. They don't have the right structure, and they needed to change the role of the medical director. So they start pushing for that. But then there will be others, in particular doctors, who once they start getting medical directors who are acting like their managers in a hierarchical system, which is what they are, they're going to say, no way, you're not my boss. I'm not doing this. I don't want you to put that kind of pressure on, or that kind of change on me. And so these two things go into tension. And what you experience in complexity, the emotional feeling of it quite often is tension. Another word for tension is stress. So people are going to be experiencing stress. The best way you can deal with that is to turn that stress into adaptive tension. Don't make it dysfunctional. Don't make it distress. If they're distressed, put them back into a steady state where they can function again, but then engage that tension. And in our model, we refer to that as conflicting. So I'll explain that in one second. But what happens is, because people experience the tension, they don't like it. And so they look to leaders to take the tension away. They look to leaders to fix this problem for us. Take care of us, take us back to where we were before. We don't like this. And then we get rid of the tension artificially. And then we wipe that out. Once we get rid of that tension, people start feeling better again. We've actually wiped out what we think is the complexity challenge, and we're still in the old state. So that's what the order response looks like in the adaptive process. Tony, do you see that happening? People pushing for order and the tension, the experience of tension, and how people wipe it out.
Yeah, for sure. And even just sticking with the example that of the trolley weights. I mean, I actually really understand the order response. I mean, for an individual patient, it's a really awful experience. To have to spend time on trolleys. As healthcare professionals or providers, we know that that patients that spend time on trolleys or spend too long on trolleys, that they have poorer outcomes in terms of their health. They've got, particularly in older patients, we've got higher levels of mortality for patients that are on trolleys. So it's a serious issue that people are very, very exercised at all sorts of levels. It's also a really political issue as well. So the push to get back to an order response, to bring us back from this chaos. And it has been described in many hospitals as chaos, actually, is really, really strong. But one of the adaptive response that I see most recently actually has been on the other side. It's been on the waiting list. You know, patients that are waiting for elective treatment and they sit for years and years because the system that we have is that they go to their GP and the GP makes a referral and the referral sits in on a list, and then eventually it rises to the top of that list and the person gets called in. And so we've come to accept that the waiting lists are inevitable and people just accept that they're going to be waiting for long times. And and then there's a push for to kind of to put a shape on that or to try and sort that out. And there's a tension that arises. Patients themselves, they want to get treatment. They've developing morbidity or developing symptoms and so on, and they want to get sorted. Their GPs want to get them sorted. Of course, it's a huge political issue again. It reflects poorly on public representatives if they've got big waiting lists in their public health system. So there's a significant tension there, to try and address that. And the way we've tried to do it in the past is we've tried to get, kind of just better at measuring it, better at driving it, better at getting more efficiency, getting more patients through our clinics, and getting more clinics, getting more, whatever. And that was up to this year. This year we took a slightly different approach, which meant that we were, how to call it, I suppose we were trying to not just deal with the waiting lists in the way that we've always done with them, but maybe just get rid of them if we could, And we had a really good example in our diabetes service in the West. Actually, it's not across the whole region, but it's in the southern half of the region where the waiting time this time last year for an appointment was about 3.5 years. And that meant that patients were waiting a long time to get a diagnosis and then get put on the proper pathway for treatment and that. But we took a different approach. We agreed with our hospital consultants that they would work outside of the hospital. So they work now in what are called community hubs. They work more closely with GPs, and they work with a broader team, which includes, nurse specialists and advanced nurse practitioners and so on. And their first task was just to kind of, deal with the waiting list. Don't do anything else, just deal with the waiting list and clear that. And then set up a system that offers the GPs or offer patients, access to their services within 1 week. And so today we've gone from a situation of having 3.5-year waiting list to literally a patient with possible diabetes being seen within 10 days. And so we don't have a waiting list anymore. And our clinicians who were resistant to the idea at the start, one of them in particular, a really great guy, and he says, I've worked 40 years in the health services in America, in all sorts of different places, and in Europe, and now, of course, for the last 20 years in Ireland. And he has never experienced anything like this in his career in terms of a transformational approach to the delivery of care. So it kind of, for me, it reflects that adaptive response. It stops doing things, we stopped doing things the way we always did them. We've allowed, or we've accepted the fact that, diabetes is one of those things that requires the GP to have an input. It requires, a multidisciplinary team, including the consultant, but it also requires the patient to have an input into that as well. And that's really complex, very difficult to control. But if you kind of roll with it, and kind of make sure that we're all trying to achieve the same thing, you can get really good results. So diabetes is one example. We're hoping to do the same with older people services now as well. We're hoping to do it with cardiology and maybe respiratory illness as well, and to expand it out and to try and scale it up. So that's it's been a great demonstrator of how things can be done differently, but we still have to scale that up now.
It's beautiful. I love that, because what you're describing is the complexity challenge. So the complexity challenge was this waiting list. How do we take this 3-year waiting list and shave it down? And it required a lot of discussion. I'm sure there was a lot of experimentation, a lot of input. You can't control it, so you're engaging in a different way. And that's really what we're talking about in terms of, don't just stay in the same system. Don't just try to be efficient in an old system. Let's generate a new system for doing this. All right, so let's show what that looks like then. What you just described, Tony, is the core of what we describe as the adaptive response. And in the adaptive response, what you're doing is you're engaging people together to try to understand how we can do something differently, how we can generate an adaptive solution. So you knew that you had the complexity challenge of the wait time, and you were trying to get that down. So then you started to generate some adaptive solutions. You did that by engaging the pressures. So what motivates the system and keeps people doing this work, this hard work, because this really is hard work. I'm sure the people, Tony, who did this, they worked really hard on the challenge they were facing. And the reason that they could keep that going, because sometimes you want to give up in it, is they're feeling pressures. They know that this is something. Some of those pressures come externally. It might be from patients, as you described, or from the system itself, but some of them come internally of people saying, I don't like this. I want this to change. I don't like seeing patients have to wait this long. I know that people are dying. I know that families are suffering in the process. So that pressure gets used to help push the system for change. Now, if I have the ability to do this easily, I would also put the pressures on the other side to say that where this works best is when you have pressures coming that have the push for change, but there are also pressures on the push for stability. So those people who want to be in stability feel the pressure as well. And that motivates them to then engage together in the conflicting. And I want to ask you, Tony, about the conflicting, because for the process to work, we have to bring heterogeneous ideas together. So people from different aspects of the problem coming together, engaging and conflicting. So they bash the ideas together in what we call adaptive space. They have the safe place to do this. And in the conflicting, they're able to generate some connecting. So you and I would be conflicting, and then we say, now we got it. We've got some connecting, and we can get to the adaptive solution. That's what we call adaptive space. And that's the basis of what has to happen. First, you have to come up with the solution. And then, as you said, you've got to scale it. So I don't want to get to the scale stage yet, but can you tell us about what the contexts were like? How did you create the adaptive space for this conflicting and connecting to occur?
So I don't know is the short answer, but I have some ideas of what we did, so I don't have all this down pat, but one thing is for sure, right, again, for waiting lists, there was a real push for stability within our system. We need to, again, we have to answer the government for the funding that we receive, and therefore we have to be able to count the numbers and show them how we're improving on our waiting list. We have to continue to deliver services in the way that we've always done that. So there was a conflict then between that and I suppose the people who were advocating for a different way of approaching this. I think where we found middle ground was on actually agreeing what it actually was, what we were trying to achieve. So it wasn't about reducing waiting lists. It was about trying to improve the health of the person with diabetes. Interestingly, patients were always very clear on that. It was us working within the services that had lost sight of that, maybe to some extent, and maybe the funders of our services had lost sight of it. But actually, the goal of all of this, if we take our diabetes service, was to try and improve the lot of that patient that had diabetes and make sure that he had he had better outcomes for himself and so on. So that's where we found the common ground for sure. I think you're absolutely right. I think there was at different points, and still actually there's the risk of people kind of falling back away from this the approach that we've implemented because there's still that urge to go back to the old way of doing things because it's it's the way we've done things before and and so on. There's still that pressure there. But without a doubt, we have definitely done something different and demonstrated that this can work.
So in the wanting to go back, we call that the pull back to equilibrium. It's really hard to get a system to fully change because it almost always wants to pull back to the old order, to the equilibrium. So when you have ongoing pressures and complexity pressures, they can help that system move out of the old and into new. And systems that are really good at this, and what business organizations have learned, is how to get to those new states. They don't get pulled back to equilibrium in the same way. And I would say to people listening to this webinar today, I would encourage you to think about what you can do in your systems to make them more adaptive so that they don't have that pull back to equilibrium. People have more of an adaptive mindset. They're less pining for the past. They're really understanding the value of this ongoing change and making the system better. You also talked about improving the health of patients. So the problem of the wait time wasn't what motivated people. And in the model, what I've learned as we've done this work is, honestly, it's pretty easy to do conflicting. for people to come together, especially in today's world. In the old world, when I started this work, people didn't do conflicting. They weren't voicing, they didn't feel comfortable sharing their opinion. They thought they were experts and they would follow experts in order. We know that's not the case today. People have no problem with conflicting. The challenge we have is connecting. And that's the case for everyone. I think everywhere around the world, this connecting is the real challenge. And so, as you described, what happens is the connecting here that motivated the whole system to change was the health of the patient. That's what kept them working together and interdependent. And then I also want to point out that it is important that you have the push for stability, because that is reality. You need to be able to report to the government. So the push for stability is not bad. The only time it's really bad, I would say, is if it is pulling it back to the old order, if it's not changing. But the way this dynamic works, if you've got people who are ideators and innovators, and I tend to be one of these, I'm like, let's go, let's do this. You need to have those other people who say, whoa, hold on a second, you're going too far with this, or we need to think about these things. So that core dynamic of people pushing and ideating for change, and the people who have the efficiency, results, stability in mind, that's the key part of the tension that you need to engage. Okay, so I'm going to show just a little bit more here. Thanks, Tony. That helped a lot. So what I'm going to do now is just end this by taking it now to the scaling. So if you have been able to generate some solutions, so they came up with some things that maybe worked in certain local levels when they were addressing this problem with the wait list, the wait time. So then what has to happen is you've got to scale it. And you mentioned this yourself, Tony. So what happens at this stage is now that process that I showed you is mapped onto the organization. It's the same process. If you take the entrepreneurial and the operational, it's that same force of the push for stability and the push for innovation. So the entrepreneurial is the new ideas, innovation, learning, growth. The operational is the results, the efficiency, the executing. So now what you need is adaptive space in the system itself so that you can scale across it. And here you have to start with an idea. So the entrepreneurial group and the adaptive space generates the solutions. They do it through an iterative process that's down here on the left, but they've got to push it out. And as they push it out, they're going to hit resistance in the system. They're going to hit conflicting. What I find is the biggest mistake people make here is they don't do this process right. They get excited about their idea, they start to push it out, but they don't have the savvy to understand what it takes to drive it in the system. Number one, people need to understand you are going to hit conflicting. It's absolutely going to happen. You're going to have pushback. So it's a natural part of the process. Expect it and prepare for it and engage with it. What people do is they refer to it as a brick wall. So it's like, oh my gosh, I got to know. They told me no, or I hit the brick wall, or the system is not willing to change. That's because of the way they're driving it. So I tell people, don't go out too early and ask for a committee to give you a yes answer. You've got to do all your work to get people on board with you so that you know you've got the votes before you go to the committee. The committee is the last stage of this to say, yep, we're all with you. We understand it and we're going to approve it. So there's a whole other process in this middle ground where you have to have enabling, adaptive space and enabling leaders who can help it flow across the system. And then by the time it gets to the other side, it looks very different. So does that resonate with you, Tony, in terms of the scaling?
It really does. I had a very interesting meeting last week, actually, with the clinical teams that have been leading on these innovations. You know, so I mentioned diabetes, and we're also trying to push it across older people service, respiratory service, and cardiology services as well. But they're at a kind of they aren't as advanced a stage. You know what I mean? But one of the key messages, and I really thought a lot about this because I'm conscious that this is starting to happen with them, is that they're, you know, that they've demonstrated that that this is how it can be done, should be done, and so on. But we're now entering a phase where there will be, you know, the path won't be straightforward. You know, there'll be hurdles along the way. There'll be problems that'll arise, that'll test, you know, this new way that we're doing and delivering the service. You know, and so my message to them was, first of all, don't be surprised when that happens, because it will happen. And when it does, then think about how do you react to it, and how you react to it is what will get us through to the far side, I think, you know. So so it absolutely resonates with me. It really reflects exactly where we are on that program, I think. Yeah.
And so this is a different kind of leadership too, because now what this is saying is First, we need the adaptive space to allow for the entrepreneurial. So as leaders, we have to allow those groups to come together and do this process of ideation to generate a solution. But then as leaders, they have to do exactly what you did, Tony. They have to say, it's going to roll out. You're going to hit these problems. When it hits the problems, let me know. I will help you with it, or we'll find ways to get through it. We'll break down barriers. We'll help create the connections. Sometimes, and I will tell people who are in the entrepreneurial who are trying to drive this, what they have to do is you take it back. So the information that you get is the pushback you get is information. It usually there will be some legitimacy there. So how can I then change the idea based on the input that I've gotten to think about how I can make connections with the other parts of the system? And you see then this point here of sponsoring. Sponsoring is really important, and that's what you were doing, Tony, as you're helping them, is you're helping them understand how to make that connection between the entrepreneurial space and the operational. So sponsors are ones who help push the idea through or pull the idea through to the operational system. And the operational here, the biggest change is they have to change their mindset. So instead of being rigid infrastructure, the mindset of operational has to be that I am willing to accommodate change. I'm more flexible. I'm more adaptive. I understand that as an operational leader, my job is to look for these things and figure out how I can help get them into the system to make the whole system overall adaptive. And there it is. Make the whole system adaptive so that when this process is done, it feeds back in the form of new order. So I'm going to stop here because I know we're at time. I want to conclude this by saying, if you're doing this properly, this cycle you see here is happening on an ongoing basis. It's happening all over in little pockets and big pockets. Your job as leaders and as people running organizations is to have them continually doing this. This is like the idea of continual renewal, where if you address issues and you enable the right process, you've got new order happening all the time. All right, so John, I'm going to stop there and let you pop back in. And thank you, Tony, for your examples and for helping with.
Thanks, Mary and Tony, for really stimulating 15 minutes or so. Really, really interesting and lovely to see the clear examples to go alongside the theoretical ideas from Mary. So we have a couple of questions and maybe comments. The first one, and maybe we might just take them in turn. How can we stop the obsession with data continually obstructing the more complex discussion on meaning? And I think that's one of the points maybe that you raised, Tony, that, you know, in a sense, the focus was on waiting lists, but that's a kind of a data issue almost. It's a numbers point. So how do you actually get that shift? And like as a researcher, obviously data for me is really important, but I take the point in services, people possibly feel over-monitored, over-evaluated, you know, completing information requests continuously and not really seeing that coming back into the system by way of useful information or change. So any thoughts particularly on that point about how do we kind of get away from the obsession with data?
I'll jump in first and say, I see this, and I have been, as a leader myself, dealing with this recently. People get obsessed with measurement, and so they're focused on the measure. So we have a company that's trying to hire our students, but they're so obsessed with holding site visits and having students come out that they got upset because 4 or 5 students didn't show up. And I'm thinking to myself, well, why do you care about whether the students are going to show up or not? Obviously, they're not going to come work for you. You've lost sight of the goal. Your goal, you think your goal is check a box. I had these site visits and this many students came. But no, your goal is really hiring. And what are you doing to hire? And I can't make that connection with them yet. I haven't gotten them there. But that would be an example of how I think, John, you're raising, it can be used inappropriately. But let me tell you how it can be used appropriately. We did some research on an organization that's highly adaptive in this way. And what I found out, and I've used this since I found it out, is that you use the data to make your case. So people who are doing this well, they use data to loosen up the system for change. So you need it. And I did this with my faculty. My faculty are in my department, our management department. We're trying to change our core curriculum for across the business school. It's the same curriculum I think we've had for 3 decades. I mean, we're resistant too. And so our associate dean came out and tried to change that. And immediately people said, no, they're coming after us. They're coming after our course. So I said, stop. You, associate dean, need to stop. Committee that you sent it to, stop. Give me some time with my group. And so what I did is I started putting data together, and I showed them what the problem was. We have a course that we teach that has this many tenure track faculty in it and this many adjuncts, meaning the whole thing is taught by adjuncts. We're not delivering good quality here. So once I showed them that, they understood. Then I said, okay, now what is it? What's the other reason? And they said, well, we want to have this course so we can hire strategy. So we have a strategy group. I said, now that I get it, I can address that. We can come up with a solution that can work. So a little bit of a long answer, but hopefully, John, that helped with that question.
That's really clear. And Tony, what about from your point of view operationally? I mean, do you feel that in your leadership role around the emphasis on data versus meaning as the question raised?
Yeah, so there's kind of two things that strike me about it. One of them is that within the health service generally, I think people will understand this, we're really good at measuring and reporting on failure. So I can tell you exactly how many patients this morning I failed to find a bed for in a timely manner in each of our 6 hospitals. I can tell you exactly how many people we failed to get off waiting list in a reasonable time. But we're much less good at reporting on success, like, for example, health outcomes. So for me, I think I mentioned that I've moved into a new job, regional role. One of the prospects of that new job is that it allows us to look at population health and really to focus on, what it is that we're actually trying to achieve. Go back to the patient that I mentioned with diabetes. It's his health rather than the inputs that he received in order to get him to that point.
Great, thank you, Tony. So the second question really is asking about, well, is it, how do you actually maybe encourage leaders, and is it possible to encourage leaders to use the language of adaptive spaces or something like that in terms of their experience of, moving things forward in some kind of stuck systems, if you want to describe it that way. So Mary, do you want to go first on that one?
I do. So when we started the work, we had all kinds of complexity language. And my colleague, who was the complexity scientist, said, but they have to learn the terms. And that was where we ended up kind of splitting, because I said, me teaching them terms is not going to do us any good. I need them to understand the concept. So I think we've narrowed it down to the most basic words that you need to understand. And the most basic words are the idea of the adaptive response versus the order response. So you need that first. And then the idea that to enable an adaptive response, we have to as leaders, create or enable this adaptive space. An adaptive space, in the simplest terms, is the space for the conflicting and connecting, for these competing pressures to come together and ideate new solutions, ideate novelty adaptive solutions that you scale into the organization. So I believe we've gotten it to the simplest language I can provide. I think that once you start, people understand adaptive space. I've done this for a healthcare system here. I was informed on Monday by one of the consultants for that, the internal consultants for that group, that one of the presidents of the system now has adaptive space on his wall. He's written the words and he's using it over and over again to help people understand what they need to do. So I think the words make sense.
Great.
And if I could, John, just actually, I think it was on the previous slide, but I don't recall it from our warm-up session, maybe, but the sponsoring or sponsorship role really struck a chord with me this afternoon. I can think of 2 really significant leaders within our health services that I see exactly in that role. I'm not sure if they see themselves in it, but I absolutely see them in that role for sure.
Okay, I think a really excellent question here, and it's the one that maybe myself and Aisling have been, tricking around with, which is the notion of risk. So the suggestion that an adaptive system requires you to be more risk able, risk sophisticated, and again, current risk adverse systems push us towards the old system responses. So how do we go about that? How do we and first of all, maybe the question is that the case? Is there greater risk when you take this approach to leadership? And and accepting that, then how do you actually get people on board with that possibility of greater risk and maybe greater risk of things going wrong?
So John, I will tell you, and I feel this one in my core, when you ask this question, the risk is the order response. Greater risk is associated with order. So organizations and people who are staying in order are putting themselves at tremendous risk. I would message that over and over and over again. The risk is that they could die. I mean, in complexity, literally, you could find yourself outdated, obsolete, your organization can't function, you're completely inefficient. So the risk is associated with order, staying in order, in an old order when the world has changed around you. That's the first message. And I hope people heard that, and I hope you felt that strongly, because that's a really important message to get across. The second piece is, if people are thinking that adaptation is risky, what I always encourage people to do is don't come up with a change and then drive it in. That's not the way it works. You do piloting and experimentation. So you go and you try something, and if it doesn't work, that's not failure, that's just information. So you have to adopt an experimental mindset to this kind of thing. You don't go get a beautiful, perfect solution and then think that's your solution. That's the whole idea of this slide. You're continually experimenting. So use an experimentation mindset, ongoing after action reviews or evaluations. This is where design thinking and why it has taken off and why it's become so important.
Great, Mary, thank you. Tony, any thoughts particularly on your experience of that?
I mean, first of all, I suppose I think we're at, it isn't always the case, but I think we're at a particular time in the Irish Health Services where there's a greater appetite for changing the way that we do things, and that's supported at the highest level within across the country. So that's the way things are right now. It's not always that way, so we need to make the most of that. But I think what's behind that is that our access issues are so stark, they really are, and the impact on patients is so significant. And we know that the prospect with population aging and population growth, that it's not going to get better. There really is no choice now except to change. And if we don't change, we really will have failed, or at least if we don't try to change, we really will have failed. So I think that's probably where that comes from. We've reached a point where the impact of continuing to do things in the way that we always have it's too significant.
Thanks a million, Tony. Just in terms of, I suppose, sticking to the rules of the game, this is a 1 hour seminar, a webinar. So we're just gone by 2 o'clock. So I think before I hand over to Aisling to close the event, just to say a strong thank you again to Tony and Mary. I'm fascinated. I could talk about this for hours. There's so many questions in my head and so many interesting points being made all across the last 60 minutes or so. So thanks both. And Aisling, I'll hand over to you.
Okay. Thanks, John. A huge thank you to Professor Mary Olbian and Mr. Tony Canavan today. I just thought that was a really, really interesting, vibrant, informative discussion. I think from Mary learning how to do leadership differently in complexity, the idea of adaptive responses, order responses, and the whole thing about enabling that adaptive space. I personally thought your diagram around chaos, complexity, and order made just such incredible sense to me when I saw it first, and I just find it extremely helpful. And really hearing directly from you, Tony, about the huge interest and focus, in working these ideas through, and examples you have of working this kind of thinking through in practice is really inspirational. And I think the West is in great hands. So thanks to both of you very, very much for your inputs today and your expertise. We're hugely grateful to you for coming along today, John, myself, and Gillian. And a big thank you again to Gillian for organizing the event today. Okay, thanks, folks.
Thanks, everybody. Thank you.
Thank you.